Greta, Liana, and I had schizophrenia and psychotic disorders. Schizophrenia, the symptoms, delusions, which are false beliefs that are not based in reality, hallucinations that are seeing or hearing things that don't exist, disorganized thinking, which is disorganized thinking is inferred from disorganized speech, disorganized or abnormal motor behavior, which is childlike silliness to unpredictable agitation. Next is negative symptoms, which has reduced or lack of ability to function normally. Schizophrenia, what is happening? Doctors don't know the cause of the disease, but they know it's from genetics. Dopamine is tied to hallucinations and delusions. That's because the brain areas that run on dopamine may become overactive. There can be too much glutamate activity in certain areas of the brain. As the disease progresses, those brain areas have too little glutamate activity. Possible causes. There's no known specific cause, but it's a combination of physical, genetic, psychological, and environmental factors that can make a person more likely to develop the condition. Worldwide, 1% of the population is diagnosed with schizophrenia. Approximately 1.2% of Americans have this disorder, and 1.5 million people will be diagnosed with schizophrenia in 12 months.
Oh, here's some of the history of schizophrenia. It was first identified by Dr. Emil Kraepelin in 1887, and he used the term dementia praecox for people who had symptoms that we now associate with schizophrenia. A Swiss psychiatrist, Eugene Bleuler, first used the term schizophrenia in 1911, so he's the first one to kind of bring that into the world. And he was the first to describe the symptoms as positive or negative. So he kind of explained that further. And he changed the name to schizophrenia, as Kraepelin's name was misleading, as the illness was not a form of dementia. So he kind of differentiated between the two. And so here are some of the most common treatments for schizophrenia. They typically vary, but depending on the type and severity of that person's symptoms, and whether or not the disorder is depressive or bipolar, the types of medication can be different. So the first one is antipsychotics. This is the only medication approved by the FDA specifically for the treatment of schizophrenia, and And then the next one is mood stabilizing medications. So these mood stabilizers can help level out the mania and depression if you are bipolar type. There's also antidepressants, which help manage feelings of sadness, hopelessness, or if you can't sleep. And then the last one is psychological therapy, which is pretty self-explanatory. And so we have some statistics, and we just thought these were interesting. So 3/4 of people with schizophrenia develop the illness between 16 and 25 years of age. So a pretty young, not pretty young, but you'll know soon in your life. And 25% of those that have schizophrenia recover completely, and 50% are improved over a 10-year period, and 25% do not improve over time. So you can get help if you have schizophrenia, basically. And then the last one here is that treatment and other economic costs due to schizophrenia are enormous, and it's estimated between 32.5 and 65 billion annually. So it costs a lot of money, and it's very expensive.
Some more disorders. There's an disorder called paraphrenia, which includes delusions with strange or unusual thoughts or eccentric behavior. Unlike schizophrenia, their personality isn't usually disturbed, and they typically have normal lives and effects, and this occurs more commonly with older patients. Bipolar disorder is a disorder associated with episodes of mood swings ranging from depressive lows to manic highs. There's obsessive-compulsive disorder, which is excessive thoughts, obsessions, that lead to repetitive behaviors or compulsions. And there is substance-induced psychotic disorder, which is a condition that causes symptoms like hallucinations and delusions and they are triggered by misuse of drugs or alcohol. The case study, it was about a 19-year-old boy who was an avid skateboarder and snowboarder. He often got injuries and would fall, and he went to the doctor about like 11 or 12 times for different injuries, and he was diagnosed with shoulder injuries, spinal injuries, all sort of injuries like that. And on his last appointment, he said that the reason that he was falling all the time was because there was a implant in him, and the government was controlling him to fall and hurt himself because they didn't want him doing that. And he also believed that his loved ones and people around him had implants like this too and are being controlled. So he started to distance himself from his family and his friends. And his doctor made him make an appointment with a psychiatrist, and he was diagnosed with schizophrenia. And then this last slide is art and pictures and paintings that people with schizophrenia drew to try to exhibit and show what they felt like and what it felt like for them. And then our last slide is our sources. Thank you.